What was that moment when you knew that this was your true calling? End of life care was what you were called to do.
I think I remember the case that really brought it home for me, because I had done, a lot of work with a patient and a patient's family, and they were, kind of, I don't want to say begrudgingly, but as most people do, they needed to have conversations about what was going on in the room. And then eventually they were able to change the patient's code status to a DNR. And I went home that night feeling pretty accomplished with myself for, putting that work in over the course of maybe 2 or 3 days.
Yeah.
And then the next day I came in and the patient had arrested, had gotten CPR, and was now, alive, and very unhappy about the fact that she was now, on a ventilator, hurting and alive.
Which so was DNR, for those who don't understand or who may not be medical here, the patient is upset because they did not want to be resuscitated.
It just really brought to the forefront, a couple of things for me over the years in the ICU. We do a very, very good job with the medicine aspect of things, but it is almost our sole focus. And we oftentimes don't have conversations surrounding things like, what if these interventions that we're doing don't work? Or where would you like these interventions that we're doing to stop? And then also, giving patients the freedom, if they're able to participate meaningfully in those conversations and give them the space to decide for themselves what is best for them, and not have us kind of decide that for you. And in that case, obviously somebody decided that day to do something, for that patient. And they were not too happy with it. And so, it really just became this thing that I was very interested in. I saw a big need for it because it was clearly a huge gap, in healthcare, in terms of, the conversations that we were having as staff about patients, and that was a big pet peeve of mine, was you kind of have these water cooler patients that everybody in the unit's talking about, even the providers, and everybody's just kind of wringing their hands together going, why can't we make movement here? And it's like, because the way that we're talking about it as professionals is not what's happening in that room, and they need that clarity. They need it in a compassionate way. You need to have some training when you have these conversations, but the conversations that I was having as a bedside nurse with the team versus what conversations were happening in the room were night and day. And it became clear why patients and families were really struggling to, come to terms with what was going on in the room and how to approach those decisions appropriately.